Hello, good day. I'm Ryan Macasero, multimedia reporter for Rappler. We are here at the Manila Hotel where the Philippine government launched its new initiative, the Philippine Multi-sectoral Nutrition Program, which aims to address stunting in Filipino youth. To give you some data on that, according to a study from the World Bank, at least one in three Filipino children suffers from stunting. So the program is a World Bank funded program, which they will receive funding of about 10 billion pesos alone to address this problem in the Philippines. So it will focus on the first 1,000 days, and this is in the development of a child. Its first 1,000 days is very important, and in children where stunting is not addressed, it can have several health and life consequences, such as mortality from infections, developmental delays, uh, emotional and motor skills, developmental delays, lack of physical stamina in life, and an increased likelihood of low economic activity. So, ongoing behind us is a session where they're discussing the different ways to address stunting and malnutrition in the country, and of course, this is going to the effort will take multiple with cooperation with multiple agencies such as the DepEd, DOST, the LGUs, DILG, but the program itself is being headed by the Department of Social Welfare and Development and the Department of Health. The Department of Health officer in charge, Maria Rosario Vergeres, said earlier that they wanted to take a multi-pronged approach to addressing the issue of malnutrition, because it's not just about health but also economics. People in the lowest economic bracket are more likely to be affected by stunting and malnutrition, which in effect also impacts their children's ability to learn in schools. So this is launched this year, so it's still in the early stages of planning, and the according to OIC Vergere, the DOH will have 30%, will be responsible for 30% of funding this project, the DSWD 70%, and they will be launching in 250 municipalities across the country in 12 regions in the areas that are most affected, or who have the most cases of stunted children, and who also are some of the most underdeveloped places economically in the Philippines. So, according to information about the program, the program will finance and support initiative measures and have interventions in the LGU level. So, some of the speakers that were here today include Gust- uh, both in person and virtually, Gustavo Gonzalez, United Nations Resident Coordinator, the Chief Minister of the Bangsamoro Autonomous Region of Muslim Mindanao. Earlier in the day, President Marcos came to speak himself at around 9 a.m. for the launch of the program, and really reiterated his support for making sure that that the government starts to address this problem as soon as possible. So he was introduced by DSWD Secretary Rex Gatchalian, and this is one of his, I think, first program launches that addresses health in youth, especially. Uh, aside from the DSWD and DOH, a lot of LGU representatives are here who will be implementing the programs on the ground. There's not too much information yet on what exactly will be the mechanics of the program, although they said that it will be multi-pronged in effect. It won't just be about feeding or doctor's visits, but having a more holistic approach in identifying the families that need these programs, especially. So we will be monitoring the launch of this program, and For more, you can follow us on Rappler. Again, I'm Ryan Macasero, Rappler, Manila.